Bismillahirrahmanirrahim. Rabbi Zidni Ilma. It's going to be hard, but hard doesn't mean impossible. Assalamu alaikum, everyone. Under the supervision of Professor Saira Afzal, my name is Dr. Sadia Rafiq, and today my topic of presentation is Health System Model. Learning outlines include the Health System Conceptual Framework, System Approach Model, WHO Model, relevance of concepts of health system to the district health managers, recent advances, and multiple choice questions. Learning outcome. At the end of this presentation, my colleagues will be able to describe health system models and the relevance of their concept to the district health managers. Health system, conceptual framework. Several models of the health systems have been developed to illustrate the various components, functions, goals, and objectives of the health system. Each model demonstrates different aspects of the system. No model is universally accepted as a perfect model. Two health system models are presented here. The first is based on a system approach. The system approach is an effective analytical framework for the solution of problems and consists of 6 essential elements, including identification of the problem, definition of the objects, examination of alternatives, evaluation and selecting solutions, integration of solutions and implementations, and the use of feedback throughout the process. The second model has relatively recent being proposed by World Health Organization as a theme of the Millennium World Health Report 2000 on health system improving performance. These two models do not contradict each other in any manner. The WHO Health System Improving Performance provides a comprehensive macro policy framework for evaluation and comparison of overall functions and objectives. The system approach is more appropriate for use at the micro implementation level. Starting with Health System Model 1, System Approach. The health system model based on system approach illustrates the three important elements of district health systems, which are community, healthcare delivery system, environment in which two other are located. As you can see in this picture, the three elements may be visualized as three concentric circles with the environment forming the outer circle, the community the inner, and the healthcare delivery system interspersed between the two. As you can see, this outer circle is environment, political, economic ecosystem, social, cultural. Center is the community participation, and inter between it is all the health system, healthcare delivery system. I will describe one by one in my coming slides. Careful review of all of its elements constitute a system review. This, together with the ensuing analysis and interpretation referred to as situational analysis, is one of the most important steps in the health planning process. First of all, ecosystem and environmental factors. This is the outermost circle of the model, comprises of all ecosystem and environmental factors which have an influence on the health system, whether direct or indirect, including cultural, climatic, economic, geographical, political, and social settings the community lives in. These factors largely determine the nature of health problems and health needs. For instance, it is very important to take into account the literacy level, social and cultural acceptability of proposed services, as well as the economic and political situation of the district when planning health services interventions. Health problems and needs. Health problems and health needs must form the basis of any healthcare delivery system. By definition, health problems are objectively verifiable, either physical or mental conditions that reduce the quality, productivity, or length of life. Health needs are problems identified and verbalized by health professionals, by other individuals, or by the community. Service inputs. Service inputs are the individual program components of the healthcare delivery system, the infrastructure required to run the services and service program, and the service delivery structure, that is where the services are set up. This can be best illustrated by this table. You can see services inputs have three types: service programs, service delivery structure, and 3Ms. In service programs, first is essential programs selected according to identified problem or need priorities. Complementary programs include selected according to general morbidity, mortality, social and development situation, and in line with the resource availability as well as the environment ecology. Then comes the service delivery structure. It includes a service delivery infrastructure, which, for example, the health service delivery structure, the modes of program delivery according to curative, preventive, health promotive actions in facility and on an outreach basis. And the last three M's, material, manpower, and money. Material includes the building, equipment, drugs, etc. Manpower includes the trained staff, professional, and administrative. And the money is the financial resource to establish capital expense and run ongoing expense of the services. Essential intervention package. Assume a situation where high maternal morbidity and mortality and high children mortality because of diarrheal disease, acute respiratory and neonatal tetanus have been identified as priority problems. Service inputs that must be of necessity contain a program of reproductive health care, tetanization immunization program, such as one of all 15 years and older, and diarrheal disease and ARI control programs. The combination of such minimum interventions is commonly referred to as essential intervention package. Service distribution. Service distribution refers both to accessibility of such EIPs from geographic, economic, and social point of views, and their availability in terms of function, minimally required infrastructure, and resources. For services to be effective, the population must have ready access to them during most of the day, year round. The services offered must adhere to standards of quality. Then comes the management and organization. It is responsible for ensuring both integrity and functionality of entire healthcare delivery system. All systems components and subcomponents have to be covered by an appropriate management plan. Efficient management and organization is essential for translating services input into the desired services outputs. Management organization serves as a lubricant for the smooth functioning of the healthcare delivery system. Support systems. It includes all those management and support structures and systems that are essential for health services to be established and to become functional. Among these systems are the transport, management information, repair and maintenance, drug and contraceptive supply, finance and budgeting, in-service training, and other important and necessary subsystems. In the health system model, these support systems closely relate to health services input as their functionality is essential to make health services accessible and acceptable quality. Service outputs. It refers to the number, frequency, and quality of activities necessary to implement a given service program. For example, the number of pregnant women seen, the average number of prenatal visits per woman, the number of tetanus immunization given, the number of packages of oral rehydration salt distributed, the number of children with ARI referred, the number of supervisory visits held, the number of health education talks given, the number of home visits made in a given unit of time are indicators for service output. The number alone doesn't suffice to assure the desired effect. The right frequency of the specific services activities as well as the quality of their execution is equally necessary to bring about the desired effect. Service outcomes. Service outcomes are designated to intermediate results or effects in this model, such as a change in knowledge, improvement in immunization status. Without service outcome, there is little chance that the ultimate service objective, also refer to service impact, for example, reduction of the health problem, may be reached. For example, covering 85% of women with reproductive health services and an equal proportion of females above 15 with tetanus immunization are desirable service outcomes. While it doesn't necessarily imply that the main objective have been reached, that is reduction of maternal mortality and morbidity and the neonatal death due to tetanus. They represent essential milestone towards the goal. Impact. The term impact in turn designates the extent to which the main or principal objectives have been achieved and is indicative of the change in the health status that has been brought about by a specific intervention. In the health system model, impact is best represented by the box on health problems and ultimately reflects on the health status of the community by measuring such indicators as a maternal mortality ratio, perinatal mortality rate, etc. Community participation. At the center of the health system stands community participation, without which services will not reach their full potential. Community participation or involvement is reflected in the extent that the community organizes itself to address its health problems, expresses its problems and needs, and contributes to the establishment of health problem priorities through health need verbalization, which is also called demand for services. Next, supports and contributes to the implementation and running of services through mobilization of community resources. This process is referred to as healthcare contribution, and they make use of services offered in terms of health service utilization. Healthcare delivery system. Services inputs, it supports systems, input distribution, services output together with health service management and organization make up the healthcare delivery system. Appropriateness to health needs and quality of HCDS will influence services outcomes. Second, health system model, functions and objectives. The theme of the Millennium World Health Report 2000, Health System Improving Performance, the report defines health systems as comprising all the organizations, institutions, and resources that are devoted to produce health actions. A health action is defined as an effort, whether in personal healthcare, public health services, or through intersectoral initiatives, whose primary purpose is to improve health. The objectives of health systems are improve health status, improve overall health status of the population, reduce morbidity, mortality, and disability, fair financing, financial protection from the cost of ill health, and the responsiveness to clients, dignity, confidentiality, autonomy of clients, prompt attention, quality of amenities, access to social support networks, and choice of providers. The functions of the health systems include provision of health services, raising, pooling, and allocating revenues to purchase those services, investing in people, building, and equipments, acting as the overall stewards of the resources, powers, and expectations. You can see the functions and objectives of health system. These are the functions: stewardship, oversight, then the financing, collecting, pooling, purchasing, creating resource, invest and training. These are all interlinked with this, moving towards a delivering services, provisions. Then these are the function and the objective. What is objective? The main objective is to provide the health, including fair financial contribution and the responsiveness to people, non-medical expectations. So the relevance of the concepts of the health systems to the district health managers. The purpose of presenting the two models is not to confuse the district health managers, but to clarify the expected roles that they have to fulfill in a devolved setup. The first model, based on the system approach, enables the district managers to systematically review and analyze the strengths and the weaknesses of the health system based on the priority problems identified in the situational analysis and to develop a district health plan. The WHO model based on objectives and functions adds a new paradigm of not restricting the district health manager to their traditional function of providing health services and achieving the objective of improving health status. The new concept of the health system encourages district managers to play a proactive role to perform all the functions of the health system and work towards achievements of all its objectives. This role is further reinforced in a devolved setup where, as functionary of the local government, the district health manager has to function as the steward of the system, generates financing, create human and other physical resources, and provide health services that are better able to improve the health of the population of the district, protect the poor from getting impoverished as a result of ill health, and is responsive to the non-health needs of the client of the system. District health managers would thus require competencies and skills that would enable them to systematically analyze the health system and develop district health plans that successfully carry out all these functions and achieve the desired objectives. These are my references. Moving towards the recent advances. It is one of the articles in the World Health Organization about the health services delivery of Pakistan. The healthcare delivery system in Pakistan consists of public and private sectors. Under the Constitution, health is primarily responsibility of provisional government, except in federally administrated areas. In this, it is shown that the 30% health services are covered by the public and 70% by the privately. Semi-government organization like Forces, SUIGAS, WAPDA, Railway, Fauji Foundation, they cover 10% of their population. In this, the WHO supports the National Health Authority's vision and aim of reaching universal health coverage through the delivery of equitable and sustainable health services. support to the delivery of an identified package of essential services that is based on integration of service delivery, introduction of family practice, and promotion of public-private partnership models in service delivery, and the quality of services and patient safety as one of the main components of the service delivery. It is the health policy VN and which WHO is supporting. Now, this is one of the article published by Dr. Sania Nishtar. It is implementing the district health system in the framework of primary healthcare in Pakistan. Can the evolving reforms enhance the pace towards the Millennium Development Goal? In this, there is a growing renewed trust in primary healthcare as the best approach for ensuring equity in the delivery of essential health services. However, Pakistan, with one of the most widespread district health system network in the region, has not delivered at the expected capacity. The series of health system reforms agendas are now stipulated, which include the promulgation of health service packages, public-private partnerships, and people-centered focus. Nevertheless, success of these reforms will hinge on the ability of three tiers of the government and other stakeholders to work together to improve the overall performance of the district health system. This paper provides an overview of the district health system infrastructure and organization of primary healthcare services in Pakistan, the evolving governance pattern and operational significance, and merit of health system pillars for effective service implementation. So in the conclusion of this article, it was the primary healthcare still remains the most rational way for achieving health for all and Millennium Development Goals, while the district health system provides an ideal platform for its implementation. Now it's time for the multiple choice questions. In healthcare system, as compared to other healthcare levels, secondary and tertiary, primary healthcare is less costly for the community and system, less costly for the community, but not for the system, most costly or same costly.
A.
Halifa.
Yes, less costly for the community and the system. To establish a healthcare facility in a rural area, population health needs are determined by all of the following characteristics except unemployment, the rate of low socioeconomy, the excess number of new physicians per year, high incidence of communicable diseases.
A.
No.
C.
Yes, the correct answer is I'm saying all of the following except the C, the excess number of new physicians per year is not relevant to it. Community health worker is supposed to survey her allocated areas and to educate the community. The most important step in health education of a community is community discussion, contact with doctor, knowledge of local needs, announcement by loudspeakers.
C. Knowledge of local.
C.
Yes, the correct answer is C, knowledge of the local needs. To implement health system model in any community, illiteracy and socioeconomic status constitute which type of communication barrier? Physiological, psychological, environment, or cultural?
C.
Environmental.
No, the socioeconomic and literacy come to the cultural. D is the correct answer.
B. Size.
D, cultural. Management or organization serves as a lubricant for the smooth functioning of the healthcare delivery system. Which of the following is not a basic activity in the management process? Planning, organizing, communicating, and terminal evaluation.
D.
D is the correct answer. Terminal evaluation is not the basic activity in the management organization. Health problems and health needs must form the basis of any healthcare delivery system. An assessment of the health problems and health status for planning healthcare services is termed as social pathology, health evaluation, community diagnosis, and evaluation.
Community diagnosis.
C.
Yes.
Community diagnosis.
The correct answer is community diagnosis. In the establishment of healthcare system, one of the foundational principle of primary healthcare without which services will not reach its full potential is are environmental factors, service distribution, community participation, and management.
C.
C.
C is the correct answer, community participation. To deliver improved health services and better value for money through greatest asset utilization by private financing is called decentralization, public-private partnership, political will, reduction in corruption, and devolution.
B.
B.
B is the correct answer, public-private partnership. Detailed cost analysis is an important tool for review of health policy and reforms. The most important reason for doing specific cost analysis in health system is collecting additional finance and cost data, developing new financial resources, extending existing resources, assessing community contribution, measuring the cost of delivering primary health care.
E.
E.
Yes, E is the correct answer, the cost of the primary health care. Health indicators facilitate monitoring of health objectives and goals and serve as a platform to promote the development of interconnected health information system. The most important indicator used in health planning and policy making is socioeconomic indicators, maternal health indicators, family planning indicators, demographic indicators, and disease control indicators.
Demographic indicator D.
Yes, D is the correct answer, demographic indicators. This is the key, and thank you so much.
Okay, thank you very much, Dr. Satya. If you please go to your MCQ number 3.
Yes, ma'am.
This is number 2. I want you to please go to the MCQ number 3. Community health worker is supposed to survey her allocated area and to educate the community. The most important step in health education of a community is, how would you see the correct option? Because all are important steps.
Okay. Ma'am, in this scenario, basically, I was trying to find out what is the important step in health education of the community from and in relevance to lady health worker. That was in my mind that the local needs, she must be aware of the local needs first, because everybody, the people of the community will be more concerned about their need rather than any other thing. So while making this MCQ, it was in my mind that the knowledge of the local needs is on the priority in the important in the health education.
When I saw this MCQ, I just recall what are the principles of health education. And as you are looking at the situational analysis, and then comes the need assessment, because the first part is always the situation analysis,
Yes,
and
ma'am.
then comes the need assessment. First, it is the general need assessment, and then is the specific need assessment. So if for the situation analysis, it is not possible to get the situational analysis until and unless you have the certain discussions or focus group discussion, especially with the community and doctors. So all of your options, they are correct, but the most important steps are first two, that is the community discussion and contact with the doctor. So
Okay.
here we have to look into the principles of health education before going to have the knowledge of the local needs. And the
Okay, ma'am.
principles of healthcare, they are very clear that without knowing the situation, the things are not going for improvement. And that is the basic disconnect that occurred at the policy level and the ground realities. If someone from abroad or from any other country, they want to put certain policies in place, they will never ever be accepted by the people, because yes, there was a need, there is a demand, but the important thing is they are not in the context of the situation that is there. That is why we have seen, even if I uh, give you the example of polio drops, you can have a very clear understanding that why the situation analysis is more important than need assessment. Do we have the need of getting polio drops for our children? There is no dialogue or debate about it. Yes, we are in need as a community to have more polio drops for our children. But what is happening? The situation in which the polio drops are being given, it is through the lady health workers and the community workers. And we all know that the community health worker program has been launched for mother and child health. And whenever we talk about mother and child health, the most important component of the mother and child health is family planning, or looking at different contraceptive devices or and pills. So that is why the polio drops, they have nothing to do with family planning, but as they are being administered by those people who are already promoting family planning and family health. They were being considered as given the polio drops for family planning, and that has caused the mistrust in the community. So the situation is very important where there is a demand or a need. First, the situation has to be made much clearer before going forward.
Mhm.
So whenever we talk about the health, the principles of health, we always go from known to unknown.
Okay, ma'am.
This MCQ, it should be looked
Okay, I will.
according to the principles of the health education as well as the importance of the community workers and how the health education has to be delivered. So
Okay, ma'am.
my would be how how you have addressed this issue in your presentation. What are those slides where you have already addressed this issue?
Actually, ma'am, basically, I was trying to make a scenario basically on the knowledge of the local community needs, and so it's all my brainstorming, and I made this community health worker, not especially for this health education purpose, just to address the local needs. I try to make it, but I'll correct it.
Right. And the second important thing is health education. Again, it is a whole topic,
Yes,
and
ma'am.
we have not even touched it right now and today. What we are focusing is about our health systems, and yes, there is an overlap between different topics, and I totally agree that one other topic may come into your way while you are presenting on that. So you must touch it
Okay.
before going to an MCQ.
Okay,
We
ma'am.
can't do an assessment or brainstorming without having the clear concept of what is there and what are the principles that are we are considering it. As the communication is an important strategy for health education, and we know the types of communication: one way, two way, verbal communication, non-verbal, formal, informal, visual, and now the most important is our IT in communication, and we have telecommunication and other things. And why they are being used? They are used for information. They are being used for education, for motivation, for persuasion, for counseling, for raising the morals of the community, for health development and organization. So your MCQ, it is more towards the health education and health communication rather than towards the planning.
Ma'am,
So
I will
when
change
we
it.
talk about health education, I want to make one thing more clearer, that we have to make it clearer that health education and behavior, yes, they are interconnected, and there are certain strategies that can influence the behavior of the individuals or the groups, and that again depends upon the health problem. So the health problem that you have targeted is a survey that the community health worker is supposed to survey. So the health problem that is given here, it would be according to the new definitions of the approaches of health education as well as the principle of health education. And when we talk about those approaches, such as regulatory approach or having the service approach, your MCQ would fall in the service approach, because you are doing something for planning, you are doing something for making a service that is available. So we have to again look into the different models, like whether this goes into social interventional model or motivational model or medical model. So I believe it is more towards the social interventional model. And when we talk about the principles, then we would have the credibility, interest, participation, motivation, understanding or comprehension, reinforcement. Then we must have setting an example. We should also have to look into the learning by doing, the relationship with other humans, and how the feedback that is going for this whole process. Again, we have to also look at the leadership. So this MCQ, it may become the foundation of a very good planning for a health education that is targeted towards a specific problem.
Okay, ma'am.
It is out of place here, but I think that our discussion has made it clearer that something that is being overlapped, it has to be addressed first, then it has to be put in the MCQs.
Okay, ma'am.
Okay. So if you have any question, please let me know. Okay, thank you very much.
Thank you.
Overall, it is a very good presentation. Thank you very much and Allah Hafiz.
Allah Hafiz, ma'am. Thank you.